Hey Lucille, so can you tell us when after you have seen different patients, like how many can you see a day that is, I will say, safe for you, or what happens during and after you have seen many patients a day?
Mm-hmm. Yeah, typically I would say probably 7 to 8 would be my ideal client caseload per day.
Mm-hmm.
The thing about this work, how gentle it is, and the element of sitting in this neutral listening. I'm not putting any external forces or manipulations on the body, so it's not actually tiring on my body. I'm just being present with what's going on with the physiology of my client.
Mm-hmm.
Um, so it's actually quite well and easy for my body. Um, we drop into these deep spaces that are almost meditative. It's just it's very it's very clear, and it's very potent, and um, you know different bodies are different. What
Mm-hmm.
people are kind of presenting based on their life experience. Um, you know each session is very different, but the nature of this work and our training as this practitioner is to be in that quiet neutrality, and it actually is the easiest place to be, in my opinion.
So you did her feet earlier, and
Mm-hmm.
now you are in her face. What will be the connection? You're just demonstrating something really quick right now, but
Mm-hmm.
why starting in her feet?
So it's a really great way to connect with the whole of the body. The feet are the base of all the fascia lines of the body, so it's a really good way to get a sense of the whole and what's going on. It can be really grounding for people as well. The feet is the farthest place away from the head, so it can help the client to really drop in and get into their own physiology. Um, and yeah, like I said, starting at the sacrum can be a good way as well. And that's just my way of practicing. I've heard of other people who typically will start at the head or the shoulders. For me, it's kind of what I was taught, and just sort of makes sense to me, and most of my clients really respond quite well. And you can really get a sense of, the body can communicate quite easily for me when I'm at the feet about what's going on for it.
Right.
I can really get a sense of that.
So if you can, just to wrap up with the practical part of some of the things that you do, because I know you do a lot
Mm-hmm.
of wonderful things. But right now, if you can share what exactly is happening, and if you have catch up on something specific
Mm-hmm.
that will be that she will need to know about.
Mm-hmm. Yeah, so I guess I should say I do, Tessa is a regular client of mine.
Mm-hmm.
So we have done, quite a number of sessions, probably most weeks over the course of the last year or so. So her body responds really well to this touch. It goes quite deep, quite quickly. Um, and just the nature of her having a tooth extracted last week, her nervous system is really kind of needing this session. I actually gave her some cranio while she was at the dental office, so that she didn't have to get any anesthetic, which was pretty cool. But,
Well, that's the beauty, I think, of what you do, because I mean, as I see right now, you don't need any specific tools. So I think you have your hands, and that's it, right?
Mm-hmm.
Wonderful.
And my whole body. Yeah, so this is a pattern that kind of has been coming out in her sessions for the last number of them, actually. And I believe that part of it is actually getting into some birth processing. So this work, can go back to birth processing, back as far as in utero. We study a lot of embryology and kind of the nature of how the body develops. How the body creates itself is also how it heals itself, kind of back to those generational forces. But birth itself can be quite traumatic, and the body will sometimes go into these kind of rolling patterns and work out some old things, and we don't really actually need to know the whole story. We just need to know what's going on right now, focus on the health, and allow it to unfold in its own way.
Great. So with this, do you follow any with your patient any coaching? Does it is it part of something that can happen when you treat somebody?
Yeah. Sometimes we speak, sometimes there's silence and stillness. It really depends on what's going on and what the client's kind of communicating. I'll sort of ask them what they're feeling, ask them what's kind of going on for them, ask them how they are. Sometimes people have a lot to say. Sometimes, these resolution places get pretty deep that words aren't required.
Mm-hmm.
There's always a follow-up after the session, and we'll kind of talk about what I think would be best in terms of moving forward, what their kind of health goals and expectations are, and yeah, it's really case by case. It's very client specific, which is what I love most about it.
Mm-hmm.
Is there isn't just one way for everybody. Everybody shows me something different, and there's a lot of similarities in physiology, but it's very individualized, and I think it's really beautiful.
Yes, thank you, Lucille. So, well, I'm sure there will be more sessions where you can show us more, and this is really interesting, but also important for people to know how they can help themselves and have another option.
And it really is all about coming into that relationship with your own health.
Mm-hmm.
And it is there, and I'm really passionate about helping people find it, connect with it, make a relationship with it.
That's great. I can see. So that's really nice. So thank you so much, and we'll see you in another session.
Thanks, Letitia.
See you soon. Thanks. Bye.